Hello students, Rajvinder here with the new topic that is belong to nursing research and for the students belongs to my previous college. Today we are going to discuss about the scientific method. Scientific method is actually the way of conducting the study but following some particular steps. Okay. The definition of scientific methods. It is defined as the scientific methods it is a controlled systematic investigations that are rooted in objective reality and that aim to develop general knowledge about natural phenomena. What do you mean by control means the topic which are selected, that is might be very vast. For example, we are going to check the knowledge of the students regarding anemia, but before that we have to take the shortcut. Which aspects we are going to check? We are going to check about the dietary pattern put impact on the anemia, or any another habits, or the age, or any kind of disease. We have to take only one factors which are we going to investigate. Then it is a systematic investigation. How? There is some steps which we mandatory to follow. If we skip one step, then we cannot go to the another. If we follow step number 1 and want to reach up to the step number 5, then it is impossible if we do not cover the step number 2, 3 and 4, and that are rooted in objective reality. Which question or which problem statement we are going to investigate, that are totally or purely depend on the objective which we are made for the statement, and that aim in develop general knowledge about natural phenomena. Then characteristics of scientific method: they are orderly and systematic processes. Orderly means we have to follow according to the steps. It is a systematic process. If we do not follow this systematic process, then we fail to do this study. Then scientists attempt to control external factor. What are the mean of control external factor? External factors are those factors which are not the part of our study but it impact on our study. For example, you have take care of the patient in ortho ward. Some patient recover easily and some take time. It depends on the dietary pattern, the age, the HB level. These all kind of things depends the recovery. But if we take the one factor, that is particular surgery of the orthopedic ward, and the recovery, we have to check the recovery of the all patient might be same, but it is impossible because external factors matters. Dietary pattern matters. The person might be psychologically strong to tackle with the disease. These kind of external factors can impact on our study, which the scientists try to control. Then findings based on the empirical evidences. Empirical evidences is the evidences which we have to taken from our observation, from the documents which are related to our topic. Then the next characteristics continue. Findings of scientific methods can be generalized. The techniques or the techniques or method which we are used in our study, we can use on the another area which are similar with our conditions or with our situations, based on assumption or hypothesis. What is that? Assumption is the belief without any proof, and hypothesis we have some proof. If we going to find out one topic today, then similar topic might be done by the another people, and what they find out, according to that we predict our study reach up to the level or not. They are basically conducted to develop or test theories. Then the purposes of scientific method, the basic purpose of scientific methods are description, exploration, explanation, prediction, control, prescription. describe something, explore something. It depends our study, which are we are going to describe something, explore, explain, predict, control, prescribe, and to check out the relationship between the facts. Then steps of scientific methods, there are various steps, but it totally depends on the type of the study. There are quantitative study, qualitative study, which study we are going to find out. Then however, the main steps used are as follow. The first one is selecting the topic and identifying the problem. First of all, we have a question regarding a wide topic. Then we can control that, limited that question in one problem, take by taking some particular things or factor which we are going to tackle. Then defining the objective of the study. If we have an objective, then it is easy for us to follow the pattern. Then reviewing the literature. What is that? Reviewing of the literature. For example, we are going to handle the study related to anemia, and previously lots of people or scientists or researchers have done this topic. We are going to check their findings. Okay, defining concepts and variables to be studied, that concepts or variables present in a research problem statement. Then stating hypothesis. Hypothesis means we have some idea, our study, our predictions related to our study. Okay, then identifying the assumption and implementation. Assumption means we have a belief regarding something but without any proof. Ethical implementation of the proposed study. We have to take care of ethical implementation, means we have to take permissions from the particular area, particular setting which we are going to study. Then research design and method of data collection. Research design according to our study, we have to find out or select the design which we are will study in detail in the next chapters. And method of data collection, there are various kind of method which we are going to study in the future. And defining study population and sample. Population is exactly the socio-demographic variable or characteristics we have selected. The people meet that criteria or that characteristics, that is population. But the sample which we easily assess or which we interested in them, that is our sample. Then the next step number 10, planning, data analysis and discussion. Data analysis means how we find out our data. Then discussion, how we present in front of others in the form of in written form or in oral form. Then collecting data from subject and sample is the similar meaning. Then analyzing and interpreting data. Here we have applied some tests, analyze the data and interpret it. Then communicating finding of the study, communicating if we communicate our study in written form, then we have published our study in journals. Then limitation of scientific methods. There it is a very best method to attain the knowledge, but there is some limitations also, moral or ethical problem. If we are human and if we judge the humans as on the basis of behavior, then it is morally or ethically problem. Then human complexity, all humans not the similar, there is always a individual difference. That's why it is very difficult for us to check something we are going to check. And measurement problems, we do not measure. It is a different aspects of human behavior are psychological in nature, which cannot be accurately measured. And external variables control problem, we cannot control the external variables because if we going to check the HB level or we are going to improve the HB level by applying, we are giving the beetroot extract to our samples to improve the HB level, but might be our sample take some tablets or drugs to improve the HB level. When we investigate, when we give the blood samples to check the HB level, that time the HB level increase might be because of our beetroot extract or might be because of their medications. That's why it's very difficult for us to control the external variables. Then thank you very much. I hope you have clear with this. If you feel any kind of problem, kindly inform me. I feel very happy to help you. Thank you. Stay at home, stay safe.